Greetings from the Nepal Cancer Education Foundation, Kathmandu. Today I will be presenting on the topic Evaluation of Postgraduate Thesis in Master of General Surgery. The PG thesis is not merely a degree requirement. It is a reflection of a postgraduate's ability to think scientifically, practice ethically, and apply evidence-based surgery. Therefore, a structured evaluation of the thesis is essential to maintain academic and clinical standards. What is the importance of thesis evaluation? The thesis represents the transition from being a learner to becoming an independent surgeon with academic competence. Evaluation ensures scientific rigor, methodological soundness, statistical validity, ethical compliance, clinical relevance. Ultimately, it ensures that the postgraduate is capable of contributing meaningfully to surgical science. Now, relevance to general surgery. The first parameter in evaluating a thesis is its relevance. The topic must address a significant clinical issue in general surgery, whether related to gastrointestinal surgery, hepatobiliary surgery, trauma, endocrine surgery, or minimally invasive surgery. A good research topic should address a real clinical problem, be feasible within institutional infrastructure, have measurable outcomes, potentially improve patient care. The examiner evaluates whether the candidate has identified a genuine research gap. Key considerations include a clearly defined research question, adequate and updated literature review, inclusion of landmark trials, novel contributions, either new data, a new technique, or regional validation. Even replication studies are acceptable if they address a different population or clinical settings. Now coming to sample size and sampling. One of the most common weaknesses in surgical thesis is improper sample size calculation. Evaluation should include whether sample size formula is mentioned, power analysis performed, inclusion and exclusion criteria clearly defined, sampling method specified, adequate follow-up duration. An underpowered study may fail to detect meaningful differences. Coming to ethical considerations, no thesis can be considered valid without ethical compliance. The examiner must verify institutional ethics committee approval, informed consent documentation, trial registration if interventional, confidentiality protection, risk-benefit justification. Ethical integrity strengthens both scientific and professional credibility. The methodology must clearly describe how the data was collected. Evaluation points include standardized data collection pro forma, clearly defined primary and secondary outcomes, use of validated scoring systems such as ASA grading, climate into classifications, objective measurement of outcomes, ambiguous outcome definitions reduce reliability. Now coming to a statistical analysis. Statistical validity is central to thesis evaluation. The examiner should assess whether statistical software is mentioned, appropriate choice of tests such as chi-square test, t-test, ANOVA, regression, reporting of p-values and confidence intervals, use of multivariate analysis whether needed, handling of confounders. Results should be presented in logical and structured manner. No duplication between text and tables, clear labeling of graphs, appropriate units, data aligned with objectives. The results section should be descriptive and not interpretative. The discussion reflects the candidate's analytical maturity. Evaluation focuses on comparison with existing literature, explanation of similarities or differences, clinical reasoning, identification of strengths and limitations, avoidance of exaggerated claims. A common mistake is merely repeating results instead of critically analyzing them. Coming to the conclusion section, the conclusion must directly answer the research question. It should be evidence-based. Avoid overgeneralization. Be proportional to findings. Strong conclusions are concise and clinically meaningful. The ultimate goal of surgical research is improvement in patient care. Therefore, evaluation must consider: does this study influence surgical decision making? Does it reduce complications? Does it improve outcomes? Can it influence hospital protocols? Does it open avenues for further research? Clinical applicability determines real-world value. A standard format of PG thesis includes introduction, review of literature, aims and objectives, materials and methods, results, discussion, conclusion, references, annexes. Scientific writing quality is also evaluated. The thesis must demonstrate logical structures, clear language, correct medical terminology, proper Vancouver referencing, acceptable plagiarism index. Poor representation can undermine strong research. During the Viva, the examiner assesses understanding of study design, statistical reasoning, justification of sample size, awareness of limitations, clinical implications. The candidate must defend methodology and interpret result confidently. Now, to conclude, a good MS General Surgery thesis should demonstrate clinical insight, scientific reasoning, ethical responsibility, statistical competence, contribution to surgical knowledge. Last but not least, thesis evaluation is not merely academic scrutiny. It ensures that the postgraduate is ready to function as an independent surgeon with academic maturity. Thank you.